Welcome to another episode of Women in Research. My name is Nekasa Esther, and with me I have a very exciting doctor who will tell us more about herself, yes, as a researcher. Welcome, Dr. Mutavi.
Thank you.
Yeah, please introduce yourself for the purposes of our big audience.
So my name is Teresia Mutavi. I am a psychiatric social worker as well as a counselor. And I'm a senior lecturer at the University of Nairobi. I'm based in the Faculty of Health Science and in the Department of Psychiatry.
Oh, nice.
Yes.
So is that what you teach?
I teach social medicine, more helping medical students to understand how to treat patients, but they also have to look at the social aspects of illnesses in patients. So as medical students, they go through we are teaching them. We also encourage them that they also have to look at the social aspects of illness.
Yeah.
Yes.
So, Doctor, as you're busting a myth for us about psychiatry and psychiatric, it's very interesting that you're a doctor of that. So, how did you end up there, or what piqued your interest to take that line of study?
So if I remember, even when I was in my undergraduate, because when we are in undergraduate, we do social psychiatry as social workers and had a passion for mental health. Then my first employment, I worked in the Machakos General Hospital.
Okay.
And I had a passion for mental health, so I got attached to the mental health department. I worked there for 2 years. I also went and furthered my studies. I did a diploma in counseling just to help me in my practice. And in 2012, I came to Nairobi. I was posted to Nairobi. I was in Mama Lucy Hospital. And from there, when I was in Nairobi County, we used to have meetings, monthly meetings, where we could meet as health professionals just to discuss difficult cases. And from there, I developed interests in child and adolescent mental health.
Okay.
And especially children who have gone adverse childhood experiences. So from there, yes, that's how I started, and I started my journey for my PhD on the same.
Just hold on. So you studied social psychiatry.
I studied social work.
Social work.
Yes.
Oh, but your interest was piqued on social psychiatry.
Yes.
Then that's when you chose to specialize in that.
Yes.
Just a brief comment now that you've worked in public hospitals, Machakos and here, Nairobi. What's the situation like? Wait, first, psychiatry is the one for medicine, or psychiatry is this other one for talking, counseling? There's psychology and psychiatry.
Yes, the psychology, they are more or less like married. They are in the same, they are all mental health practitioners because, but you find that they have specific areas they need to concentrate. We work as a team. When we are treating a mental patient, we can, one profession cannot work in isolation. So you find that we are working as a team. The social workers, the clinical psychologists, the psychiatrists, the nurse, the occupational therapists. So it is a team that works together in treatment in mental health.
All right, now go ahead. Paint for us the picture. Like, how busy were you working in a public hospital, specifically in this department?
So I was a medical social worker in Mama Lucy Hospital, and as a social worker, we deal with children and families who have gone through difficult cases. Will end up in the office of a social worker. And then if there's a child who has gone through physical abuse, sexual abuse, then it is a role of the social worker together with the doctor. The doctor will liaise with the social worker for the social worker to look for a safe space for this particular child and to report the cases and to support this particular child. So from there, when I was in Mama Lucy, that's how I developed the interest on child and adolescent mental health, children who have gone through physical abuse, sexual abuse, trauma, or adverse childhood experiences. So from there, I developed that interest, and I actually did my PhD on that, psychosocial outcomes associated with sexual abuse among children and adolescents.
Oh, wow.
Yeah.
So before you tell us, before you take us deeper into your research, I've seen that, I've encountered that in the movies. I didn't know here there's a whole ecosystem. I've seen, they called, you know, like activists. I see people who are coming up and saying, let's raise money for so-and-so. This child has been neglected. Then they take them to a children's home. Is that how the system works? Are the children's homes the places where you say you're finding these kids a safe space, or there are parents who've come out and said, I am available, I would want to host children like this? Because I know this in the movies that I've watched abroad, I feel like there are parents who volunteer or they are paid. There's a system, there's a certain system.
So for us in Kenya, what happens is we have some children who are neglected. So those ones, when they are brought to the hospital, for especially the small ones, they will go to the nursery. Then the social worker will liaise with the children's department and get a court order and take these children to a home. Then there are those children who will come to the hospital maybe because they have been abused, physical abuse, children who have gone through sexual abuse, an adolescent. So, and when you the doctor realizes that this child needs a safe space, then they will work hand in hand with the social worker to look for a safe space for this particular child, because maybe they cannot be admitted to the hospital. Maybe the best place to place them is a home or a safe space, because maybe the abuse is happening at home, either by the parent, the caregiver, or the guardian. So that's where you find that the social worker comes in handy to support this particular child or adolescent. Yes.
So there's a system,
there's a
working system.
Yes.
Where
yes.
you, as a social worker, you can sit and call and you say the available homes ABC. You won't like take time
to
get a safe space for these children.
Yes, we work as a team. We collaborate with those organizations which are handling matters concerning children. So the social worker will be knowledgeable on the homes which are around that are able to accommodate those particular children.
All right, Daktari. Now take us to your research and now the depths of it.
Yes, I did. I started my PhD. I did my PhD on child and adolescent mental health. Like I told you, I was so much interested when I was in Mama Lucy on child and adolescent who had gone through adverse childhood experiences. And then from there, I started my PhD. By then, I had not even joined the university, but I had started doing the proposal, the study. Then I got, I was awarded a scholarship. Yes, when I now started doing the proposal, I got a scholarship for my research by MEPI. So I did my PhD. I graduated in 2018.
All right, congratulations.
Thank you.
So
thank you.
What are some of your results, if you remember? Like, what are some of the things that really piqued your interest as you were doing your research?
So some of the things I can say I came across is that children, when they go through adverse childhood experiences, have a risk of developing mental health disorders. And the prevalent mental health disorders you would see among children are depression, Like from my study, there was a high prevalence of depression, post-traumatic stress disorders. There was children who have gone through trauma. They are likely also, their academic performance goes down, as well as their self-esteem. And research has shown that when children are abused, or they are likely to, the trauma is likely to go even for a very long time. So it can be lifelong. So yes, so that's what I did. And currently I am doing a research. In 2019, 2020, we did a research called, I was one of the core PIs, psychological, equipping, ensuring quality in psychological support. And in that research, we were trying to show that community health workers can also bridge the treatment gap among in mental health. So we did that research, and we from the outcomes, one of the outcomes we saw was that community health workers can also be used to bridge the mental health treatment gap. We can use community health workers to bridge the mental health treatment gap among children and adolescents who have gone through adverse childhood experiences.
And when you do such research, have you identified a certain community where you do what? Is it like testing? Is it like your
Piloting.
Piloting? Yes.
Yeah, like that one we did with community health workers. That was in 2020.
In which region? Like
We did it in Nairobi.
Okay.
In Nairobi, Mkurukwa, Jenga. Then that was a pilot.
Okay.
Now we are also doing another large study. And I am one of the consultants. I'm not a PI, but I'm a consultant, meaning I am one of the people who are implementing the research. And we are doing it in Nairobi, Kisumu and Homa Bay, where we are using intervention called PROACT. PROACT means problem solving, relaxation, transdiagnostic methodologies that we use to treat depression and anxiety. So we used PROACT in 2020 during that EQUIP project. Now we are using PROACT to treat anxiety and depression among adolescents in HIV care. And then in last year, no, this year, I was awarded a postdoctoral fellowship.
Oh, congratulations.
Thank
Again.
you.
Yeah.
Thank you. Yeah, by Achieve program.
Okay.
And I am using PROACT to treat depression and anxiety among children who have gone through adverse, children and adolescents who have gone through adverse experiences. But this time it is being delivered by social workers, trained social workers. In the EQUIP project, the PROACT was being done by community health workers, and we saw that they are able to deliver a treatment when they are supervised and trained. Then in this other PROACT project, consultancy that we are doing, where I'm a consultant, we are using providers, lay providers, lay providers. Then my postdoctoral fellowship, I'm using trained social workers.
All right.
Yes.
On the ground, how does that look in terms of numbers, in terms of painting the problem, and how much are you able to achieve, maybe in terms of percentages?
Mine is a pilot study.
Still, like all those, the three that you've mentioned, they're all still under pilot.
The EQUIP project was a pilot.
Yes.
The one which we are doing right now is not a pilot, is a big study. Yes.
Okay.
Then my postdoctoral fellowship is a pilot.
Okay.
Just to
so
see.
the one that you're actually is the one that's a big study. The one you're saying you're implementing in Nairobi, Kisumu, and Homa Bay.
Yes.
How does that look in terms of success, milestones, achievements? In terms of percentages, what can you say you're experiencing in the community?
Yes, the reception is good because we are using also peer educators to deliver the intervention.
Okay.
And we are the peer educators, the clinicians, they are gaining more skills to deliver, to provide that therapy among patients that they are seeing. So I think the progress is good and the uptake.
That's the one for teenagers who have HIV?
Yes,
Okay.
HIV care. Yes.
So at least there you've identified, the numbers are there, and there's a way you can get them in terms of they're coming for their monthly, do they come for their monthly checkups?
Yes.
So at least it's an identified group, controlled sort of, you have your numbers and what have you.
Yes.
But generally the issue of depression, the issue of anxiety among teenagers and children has really gone up. And I believe you're seeing it even in your classes.
Yes.
Yeah. So what can you say about your, how will your research then impact the immediate or talk to the immediate problem in our society?
So my research will, I'm using an intervention that is meant to bridge the treatment gap, because we know that healthcare professionals, mental health care professionals are few, and by giving these skills, for example, to the social workers whom I'm given that we have very few trained mental health practitioners, then it will help to bridge the treatment gap to the people who need it. So for me, the way I see it, this is a very good intervention, and it is an intervention that has come at the right time to ensure that we give more skills to healthcare professionals who are dealing with these particular children, as well as the providers that we are, the peer educators that we are training, the clinicians, because it is a mixture of both clinicians and the peer educators, and they are dealing with these clients every day. So giving them skills to help these adolescents and children it will have an impact in overall, because the children and adolescents will have that treatment that they require. They will receive that therapy that they require, and in general, overall, mental health will go down, and they will be able to grow as a fulfilling life. The quality of life will also improve of these children and adolescents.
One of our biggest challenges, now I'm on this side of the university, one of our biggest challenges has been communicating our research output and communicating what we are doing. Especially because I'm thinking so many teenagers and children are out there, they may have all these issues, but number one, they don't know these interventions exist. They don't know where to get these interventions. And there's this assumption that therapy is very expensive. Mental health, access to mental health has been tagged as expensive, therefore inaccessible. So what are some of the things that maybe you have done in your own space and now you would like to amplify it in terms of communication, in terms of raising awareness?
So one way that we can do is dissemination. So like most of the time I encourage my students to publish. They've done their project. Instead of the work just remaining in the library, let them publish what they found, so that the results of what they find from from what they've done can be known, can also be implemented. So I encourage my students to publish. I myself, I publish.
Okay.
Yeah, I'm always busy trying to work on a paper here and there.
Yeah.
So for example, from my PhD, I was able to publish 4 papers.
Wow.
And I know from what I am doing in my postdoctoral fellowship, definitely I'll have several papers.
Wow.
And maybe see how, because I am dealing with the healthcare professionals, see how that we can translate it into their implementation, how they can implement this intervention into their daily practice when they are seeing clients.
Yes.
So that's the road I'm taking. So I encourage my students to publish. I myself, I publish. And when I get a conference, that's also another way to disseminate information.
What are some of the, maybe in terms of your recommendations, when you recommend, if you can remember any, there are some recommendations that I'm sure you put out there when you finish your paper and you're saying this needs to be done. Are there any stakeholders that you need their attention to these issues? Of course, like government, policymakers. Who do you call to action in your recommendations? Is it only the healthcare workers?
Not necessarily the healthcare workers. It depends on where that particular research you are doing on. So for example, you have to involve the stakeholders. And for example, if you are like the study for my postdoctoral, since I'm dealing with the social workers, then I have to involve all the stakeholders in the hospital, the doctors, the medical superintendent, in the hospitals, the social workers in charges, the parents, the community.
What do parents need to know? Are there any preventive? What's your call to action? Like, parents do this, or children need to do this, or then the superintendent of the hospital needs to do this. Those are the things I want to hear.
Yeah, so we can have outreaches where we can have outreaches where more education is done to schools. So that is also another target that I foresee, that this intervention can also be upscaled in schools, where we teach to children or adolescents about self-care, about mental health, about how to prevent themselves from trauma and resilience. So I see there's a lot we still have to do. So once I get I'm done with my research, then those are some of the areas I would target to disseminate.
All right. Thank you so much, Dr. Mutavi. I'm glad that we are talking about this in this season, because it has really been talked about, but maybe not necessarily from this academic angle, and not knowing how much you have done in terms of research. Do you have anything that you may feel like we have forgotten, a parting shot?
So I think the future is bright. And I see myself finishing my postdoctoral, maybe moving forward with an NIH grant. By the way, I have mentors.
Oh, nice.
And first of all, I would also want to thank my mentors. I had a very wonderful PhD supervisors. I had Professor Obondo. Thank you so much. She supported me so much. Then I had Professor Modoni Madai. And I really appreciate the support that they've given me. She's still my postdoctoral mentor, Professor Madai. So I am very, very grateful for her support. I also have the postdoctoral I'm doing is in collaboration from Washington University in St. Louis, and from there I also have 2 mentors. who are supporting me in research in this Achieve postdoctoral fellowship. I have Professor Powell and Professor Osgi, and they are supporting me. And I think with them holding my hand, I see myself doing an NIH grant next year.
Congratulations.
Yeah. Thank you.
Maybe a last question, one that I always ask researchers when they come here is, how easy or hard was it to juggle when you're doing your PhD? At what point of your life were you socially, career-wise? How did you juggle? Or how much time did it take you to finish?
I think when I started my PhD, I was, I had resigned from government and joined the university. I was a tutorial fellow. I started from a tutorial fellow. And you know, when you are at TF, you are on contract. You are not permanent. And so that with that in mind, I knew that I had to work hard day and night. I remember when I was doing my PhD, I used to work up to 3 a.m. just to ensure that
you've written.
Yeah, I finished. So.
And how long did it take you to finish?
I think it took me around 4 years.
Wow.
Yes.
Wow. Yeah, you must have really put in the hours.
I put 3 a.m. most of the time, and then by then I joined university in 2015. So I had already started doing my PhD. So when I came, the workload was different from the ministry. And now here I have students, I have teaching, I have this workload with me. So trying to balance being a teacher and lecturing and finishing my PhD, it was and it was worthwhile. I'm grateful.
You're grateful you're here.
Yes.
Congratulations, Doc.
Thank you.
And thank you so much for coming. Thank you so much for watching. I hope you've learned a thing or two about social medicine. Is it social medicine? Social medicine. About social medicine. I think I'm interested in your links. We need to collect the articles, the links of your articles, and post them down here in the comment section. Thank you so much for watching, and have a good one.